Hi, today we're going to do a phenol chemical peel on a patient's face with acne scars. I've kind of demonstrated with some of the close-up shots some of the acne scars, which are basically the typical pit-type acne scars. There's various types of scars that we can have, but she's got the pit-type acne scars. About 12 years ago or so, she had a CO2 laser or an erbium laser, not sure which type of laser it was, at a different surgical center. And while there was lots of crusting and peeling, the results were not that impressive. A little while ago, I think about a year ago or so, we did some dermabrasion with a TCA chemical peel to the face. It definitely improved the areas, but not as much as we wanted it to. So now we're going to go to a phenol chemical peel. 88% phenol is one of the deepest types of chemical peels you can do. This is not something that you can tolerate without any numbing shots. It's very deep, and you either have to be under anesthesia at the hospital, which is normally where I do this procedure, or if there's certain limited areas that we're going to numb, you can actually numb the area and then do the phenol chemical peel. So again, 88% phenol is the second deepest chemical peel that you can get, second only to the Baker Gordon peel, which is an extremely deep chemical peel based on the 88% phenol chemical. We're going to demonstrate the procedure right now, and it's going to be chemical peel, phenol chemical peel to the cheek areas. Now, the way I like to start this is I like to prep the face. In the hospital, in the OR, I use acetone, and it's clinical grade acetone to prep the face. And by prepping, essentially it's degreasing, taking any grease off, makeup, any kind of oils on the face, just so the chemical peel can have a deep penetration and a uniform penetration. In the office, acetone is a little bit too toxic, and it just creates a bad smell for the patients, and it can burn their nose and eyes. So what I just do is use alcohol. You can use regular old alcohol wipes, but a little bit of alcohol, rubbing alcohol on a sponge gets a better penetration. So I just clean the areas that we are going to do the chemical peel to. Now you'll notice that there's some patchy whiteness to the cheeks, and there's a few little bruises that you see. These are essentially from the numbing shots. A little while ago, about 10 minutes ago, I did an upper and lower dental blocks, numbing her inferior orbital nerve as well as her mental nerve, and then going and numbing some of the zygomatic branches of the facial nerve as well, and then doing some local injections underneath the skin as well. This is to make sure we're completely numb for this procedure, because as I said, a phenol peel is extremely deep and you have to have numbing. Topical numbing by itself, like a numbing cream, is not going to be deep enough or strong enough for this type of a peel. She has had a little bit of Valium, which makes her more comfortable. She's also listening to some music on her iPod. Now the cheeks are fairly swollen from about 20 cc's of numbing agent that I put basically in the face. The phenol is mixed by your local pharmacy. Again, this is a caustic substance, and it should be cared for like any poison or dangerous substance. It should not be left alone. How you doing?
Okay, it's not too bad. It's a little worse than alcohol.
Yeah, keep your eyes closed. I don't want any of this fume. You can kind of see what's happening. You see a little bit of a frost reaction there. And the frost is the protein denaturing. Now all these areas have been numbed. What you'll notice is that it's definitely a deep frost. Now, sometimes using a little fan, I'm going very slow so there's not a lot of fumes coming off. The other thing with phenol is that it is cardiotoxic in high doses. So when we do certain areas, if we're doing the cheeks, if we do the entire subunit, we want to split the face into 5 parts and do the 5 parts over about an hour period. We also tell the patients to be well hydrated, making sure that they're not dehydrated the night before doing this procedure. I let it sit in a little bit. And we're going to do this zone. We're going to give it about 10 minutes, and then we're going to repeat it on the other side of the face. Now the way I care for this is essentially once we're done, I'm going to have her get in the shower twice a day and wash her face another 4 times a day on top of this. And what she's going to do is make sure that nothing crusts or scabs. That everything pretty much stays nice and clean as it heals. No crusting, no scabbing. How are you doing? Okay. So we'll give this about 10 minutes, then we'll go to the other side. Okay. So we've let this other side sit. Let me have you turn your head a little bit this way. You can start seeing the frost is wearing down a little bit. There's a zone of erythema or redness around it, but the frost is shrinking. In a few hours, this frost is basically just going to be red. In a couple of days, it'll turn brown. It starts peeling, and she'll start her routine at home. Now, after giving it about 10 to 15 minutes, we're going to come and do the other side. Again, 88% phenol. A nice wet pad. The zone is numb. You can see some of the puncture holes from the numbing shot. And she's definitely swollen from the numbing. We start seeing the frost immediately. Again, this is 88% phenol. It gives you an immediate frost. The only other substance is the Baker Gordon peel, which is based on the 88% phenol, and it does a similar type of frost. 35% TCA, which is another kind of chemical peel, slightly less deep than the phenol, that gives you delayed frost. So as you wipe and you wipe and you wipe, you actually don't see the frost for about 30 seconds to a minute, and then it starts kicking in. So you have to be aware of that fact, because your end point is your frost reaction and the erythema around it that you're going to see. So if with TCA you expect to see a full immediate frost, you risk the danger of over peeling, because you'll be overzealous and add more and more and more, thinking, hey, where's the frost? Not knowing that it's going to kick in later. But with the phenol, you see it immediately. So you have to know the substance you work with. That's essentially it. Once we're done, we're going to add some Aquaphor or Vaseline ointment to her face. We're not going to do that just yet, because she's going to get a VI peel to the rest of her face by my master esthetician to just blend everything nicely so she just has a nice even coat of skin. So we finished the phenol chemical peel to both sides of the cheek. It's really important, if you're going to do not a full face chemical peel or a full face laser, to stick to the facial subunits and zones. If you start going partially in and out of zone, for example, if you just want to do half of her chin or half of her cheek, as it heals, it'll stick out more like a sore thumb. But if you actually do an entire subunit, and the subunit principles are easily available online, you can search those units, you can see that as it heals very nicely and blends nicely into the rest of the face. But she will, like I said, get another light chemical peel to the rest of her face, just so everything blends even better. But the zone principle is very important with any deep chemical peel or deep laser. Thank you.